So what are the consequences of ignoring sexual and reproductive health rights for people who use drugs problematically, have a serious mental illness, and/or intellectual disability? I'd like to tell you a little bit about Elizabeth, who we supported. So Elizabeth is 21 years old. She has been known to care since the age of 11. She was a victim of domestic violence. She has mental health issues. She uses cannabis daily. She has a poor diet and low mood. She's had 3 previous pregnancies, and all children have been removed into care. We met her on the postnatal ward at St. Thomas Hospital. A judge agreed for Elizabeth to be placed in a psychiatric parenting assessment unit. And while she was on the postnatal ward, we inserted a contraceptive implant. She is now at home and co-parenting with the father. And she had this to say about our service. Having an implant has given me the chance to get my life in order and to make things right for Z and myself. I never thought that I could do this, but now I feel I can. So I manage a sexual reproductive health service, if you haven't worked that one out yet. And we're funded by Guys and St. Thomas Charity, and we work with people who use drugs problematically, serious mental illness, and learning disabilities. But obviously that crosses over into multiple other key populations that experience health inequalities and who are marginalized, and quite a few of our patients are also homeless. We see people who are seeking asylum, we see people with severe medical conditions, young people, people who sex work, BME, LGBT, and we do focus in on women who have had repeat removals into care. So how do we work? So we know that the business as usual model of going to a walk-in clinic and mainstream service doesn't work for our clients. So we're embedded within 2 drug treatment services. We work largely in Lambeth and Southwark in South London, but 55% of our referrals do come from South London and Maudsley Mental Health Foundation Trust. So we will see any patient who's known to that mental health trust, which means we do see patients from Croydon, Greenwich, Wandsworth, and pretty much anywhere in South London. But we're embedded within 2 drug treatment services, one within Southwark and one within Lambeth. And then we also offer a clinic on a Thursday afternoon at the ECT suite at SLAM. And that's available for inpatients and for outpatients. We also offer assertive outreach. So we go into the homeless hostels. We proactively go onto the postnatal ward and we work with the safeguarding midwives. We go into psychiatric intensive care units. We go into acute mental health wards. We go to community mental health teams. We've even done home visits with social workers and with PAWS or other key workers. And we work very closely with charities and organizations that work with our clients. So with Spires, very well-known charity in South London that works with sex workers, or the Best Centre who works with vulnerable young women. Sorry, just to go back, I should add one more thing. So we also offer a priority appointment into a complex clinic, a Camberwell Sexual Health Clinic. And Camberwell Sexual Health Clinic is located in Denmark Hill. And what people then get is to know exactly what time they're being seen, which a specific consultant that they're being seen by as well, and they generally come chaperoned with their key worker or their drugs worker or their social worker. Just to say, it's not on the slide, but we're like part of our evaluation is to see which care model works best, whether assertive outreach or in-reach, or whether this priority pathway into an appointment clinic works best. And we're finding that despite the fact that we might roll out the red carpet, you know exactly when your appointment is at a walk-in center, you know exactly who you're seeing. We don't ask all the standard safeguarding performer questions, which generally stigmatize our clients. Despite all of the things that we've done to try to increase access to a mainstream clinic, we still have a 40% DNA rate from that care pathway versus a 14.5% DNA rate from assertive outreach and in-reach. That is me.